In community lies strength of numbers to support the sick and the weak. In community somebody hears me with louder voices to speak. In community we teach each other about science and art and sport. From this we gain our vitality, and through this our sickness is fought. In community disaster may come, but grief shared and faith in our all makes death's pull linger less strongly. Our tears with others can fall. In community lies our ambition. Without makes larger our fears. Together we make sense of being and bring joy and length to our years.
We've always been very, very ambitious in Network 6, but we need to make sure that we take it in steps. So our initial hopes is that we will create some really strong systems and structures in place to enable us to deliver the 7 national specifications.
There's a lot of challenges in delivering healthcare in Tower Hamlets, and by working together we're much more resilient. With the ideas from the 4 other practices within the network, we were able to turn around St Paul's Way, and we became the first GP practice in London to be accredited outstanding by CQC. I think this was a really great network achievement.
Primary care networks are looking really positive because communication with secondary care is getting much, much better. We work with a multidisciplinary team, so patient care is not really isolated, so there's good communication, and probably in the future patient care will get better and better.
I think the staff member who's made the biggest influence on Network 6 has to be Aisha Lulat, who's been our network manager for the last 10 years. She's made a fantastic contribution to the network. She's worked really hard, and she's brought the 5 practices within the network together, and can't thank her enough personally and for everything she's done for the network.
So the staff member I would like to thank for St Paul's Way Medical Centre is Dr. Jo Hall.
There is one specific person. Without her support, I think running of networks will be very impossible. So I would like to thank Anna Gutierrez from CEG. I really appreciate her help and support. Without her support, it's hard to run the searches. Thank you so much, Anna.
So the hopes for our PCN in the future would be to better deliver chronic disease management care, to strengthen relationships across our practices, and also to try and create some innovation in terms of how we engage with our residents, with our patients.
Yeah, the future as it is at the moment looks quite bright for the networks. It looks like we're going to get more funding, so we're going to be able to provide more services for our population. We're going to be able to have more say on the type of services we're going to be able to provide. We're going to be able to organize the services with our other kind of community health players. So yeah, the future is bright for the network, I think.
There's a lot of people that I'd like to thank, but I'm going to have to choose, because I have to choose one person. Our network operations officer, his name is Ashadul Alam, and he's been absolutely instrumental in helping the network and supporting the practices. And he's just so reliable, so full of enthusiasm and so full of ideas.
If I had to choose one, I would like to thank Mr. Alam, Asadul Alam. He's a great member of our team, and he has helped our team to grow, to perform. He's great.
My hope for our primary care network is that we can continue to build on our patient and community focused work without onerous administrative procedures to follow, but with sufficient financial and human resources to do so.
So I think networks have changed patient care in a good way. We work really well with our adjacent colleague practices. We work very closely. We share best practice, and if you share best practice, then patient care improves.
I would like to thank Rajbina Ahmed Koli, who's been doing recalls for our QOF purposes. She's very good.
The person I want to thank is Liz Hart, who is a clinical psychiatrist. I think she does excellent work with patients who have COPD, trying to bring them down into the practice and kind of engage with them.
My hopes for the future for the primary care networks are that they will ensure that more community events are held for specific diseases like diabetes, and having the community involved who are not from healthcare, so like schools, the local mosques, etc.
So in terms of networks changing patient care, I think they've had quite a significant impact here, locally in particular in our Network 3. So a few examples here would be, for instance, our call recall service, where we recall patients and ensure they come in for appointments for their care packages. And in particular, that's had a huge impact on childhood immunisations, to name one. Then the last thing I'd like to mention, which is also quite important, is our social prescribing service that we have here for Network 3. And that has been hugely helpful to networks and to the practices in particular in providing that sort of extra level of information and service to patients which they otherwise wouldn't get from the practice individually.
I'd like to thank Dr. Nabila Barry. She's one of the salary GPs in Harvard Health Centre. So she's very hard working. She just comes in, doesn't complain. Even though she just does 2 clinical sessions, she also does extra, like development time, just to ensure that the work is done. And sometimes I just feel that, you know, she doesn't complain and doesn't ask for anything extra.
The staff member that I want to mention who plays a big part in the role of the network team work that they're doing is Henna, our reception supervisor. Henna every day before when she comes in gives recalls, make sure that other staff are making calls to patients before the appointment or the day before to ensure that our DNA rates are very low.
I think networks have changed patient care by enabling us to know more data about how everyone is doing in terms of their diabetes or their blood pressure. We share all that data. It's all very transparent. We know when we're doing well. We know what areas we're doing well in. We know what areas we're doing less well in. So kind of knowledge is power, really. It enables you to put your resources into the areas that need most work.
My hopes for networks going forwards. I suppose I'd like to see further integration between the network teams.
I want to thank Noor Islam because he always has an answer to the millions of questions I ask him every single day.
There's a lot of names, but I guess Kim at Bethnal Green in reception. She's always there when you need her.
So before we came together as networks, general practices was very different. And I would say before 1990, we were totally independent small businesses and we didn't even connect up with the wider health services, so we just got on and did our own thing. There had been a piece of work done prior to setting up networks where the then medical director really went after practices that were not performing, and actually over that period of time they decommissioned 11 practices. A lot of them were smaller practices, but actually when we looked at the overarching quality, the best performing practice was small.
Our hopes for primary care networks are around the extended primary care teams. We're super excited to have physiotherapists, paramedics, clinical pharmacists and physicians associate as part of our extended primary care teams. So looking forward to the next 10 years of PCNs.
So my hopes is that we may be able to take a lot of services from the secondary care and tertiary care and bring it down here. And this is my vision and my hope.
I want to thank Prabha. She's been instrumental in terms of getting the network teams trained up around the EMIS web. She's actually trained me when I started into my network role onto EMIS web. So I want to really thank her for her efforts over the years.
I think primary care networks in the future will play a big part, particularly to provide the demands of the local patient by providing a coordinated and personalized and proactive, integrated social care and also health care. So I think, yeah, definitely they will be playing a huge role in the future.
Since the network started about 10 years ago, I personally have seen a lot of changes in the sense that there's more commitment as a network. We work together as a team, which is so important for team playing. We've also seen the improvement of certain long-term condition cares as well for patients, and hopefully, you know, we can progress more on it.
I would like to thank Kamal Hussain, who works above and beyond, ensuring that patients get the care that they need.
If there was somebody I would really want to thank from the Wapping Group practice, I would thank one of our diabetes lead, which is Dr. Gosha Farrelly, because we have seen that she really works hard for the diabetes, and I'd like to thank her for all her hard work as well.
I definitely recognize my social prescriber, Dobair Mohammed. His commitment to, you know, social care, you know, particularly people with lots of issues other than health, and he's very passionate about that, dealing with those people, very patient, compassionate. Yeah, definitely, because he doesn't get this recognition on a daily basis. Absolutely brilliant colleague. Yeah.
We are a community of 8 networks,
36 practices and about 900 staff.
Together we have reshaped
the landscape of primary care,
encompassing the 6 NHS.
Core values we stand behind:
respect and dignity,
commitment to quality of care,
compassion,
improving lives,
working together for patients.
Everyone counts.